babies born alive in his clinic after botched late-term abortions. Gosnell was also found guilty of involuntary manslaughter in the death of a woman who was undergoing an abortion in his care. He was sentenced to life in prison without the possibility of parole. I might remind the Senator that this happened while Roe versus Wade was the law of the land. To suggest that it somehow would absolve that kind of conduct is just plain wrong.
Thank you, Mr. Chairman. You don't need to remind me.
Senator Klobuchar.
Ms. Zarowski, thank you for sharing your difficult story with all of us today. As you know, nearly half the states in the country have now enacted restrictions or are moving toward bans. 12 states are enforcing near total bans on abortion. In your testimony, you say that traveling to another state for care was not an option for you because you would have had to drive 8 hours and risk what you called the death sentence of developing sepsis, which can kill quickly in the middle of the West Texas desert or 30,000 feet above the ground. What do you want people to know about the risks that bans and restrictions place on women experiencing miscarriages?
Thank you for that question. So first, I'd like to revisit something that Senator Cornyn brought up in Dr. Scopp's response, because I'd like to make it clear that Dr. Skopp is not my physician. She has never been my physician. She's never treated me. She has not seen my medical records. Quite frankly, my physician and my team of healthcare professionals that I saw over the course of 3 days while I was repeatedly turned away from healthcare access made the decision to not provide an abortion because that's what they felt they had to do under Texas's law. And that will continue to happen, and it is continuing to happen. And it's not a result of misinterpretation, it's a result of confusion. And the confusion is because the way the law is written, the language in the law is incredibly vague, and it leaves doctors grappling with what they can and cannot do, what health care they can and cannot provide. And if they make the wrong decision, they face up to 99 years in prison and or losing their license. And in my opinion, that was intentional because after the Dobbs decision, the administration put out guidance for when an abortion can and cannot be or should not be provided. And the state attorney general in Texas, Ken Paxton, hated that so much that he sued the government to overturn those guidelines. And so what happened to me is exactly what he wanted to happen.
And your point is that right now we have a patchwork of laws across this country. And if we would enact some federal standards here and codify Roe v. Wade into law, which was the law of the land before this, this wouldn't have happened to you.
That's right.
Okay, thank you. Dr. Verma, how do the medical consequences of delaying care impact women?
They impact women significantly. We are seeing, I am practicing in Georgia where we have a 6-week ban in place, and we're having to turn away patients for all kinds of reasons. People that have irregular periods that don't realize they're pregnant until after 6 weeks, people that are diagnosed, their babies are diagnosed with terrible fetal anomalies on their 20-week ultrasound, people that develop worsening medical conditions during their pregnancies. And because they can't access their care in our state, even though their doctors are trained to provide that care, they're having to figure out if they can go out of state, get the resources together, take time off work, figure out childcare.
And what impact would a national ban on mifepristone have on your ability to care for your patients?
It would have a devastating impact on our ability to care for our patients. We know based on decades of evidence that mifepristone is incredibly safe and effective and can be used in combination with misoprostol for both medication abortion and management of miscarriages. It's an incredibly important treatment for our patients to have available to them.
You know, since Dobbs, states like Minnesota and Illinois have become islands of care in the middle of the country. We are the states that are the islands of care. In 2022, Whole Women's Health of Minnesota in Bloomington saw the percentage of out-of-state patients that they treated increase to more than double the numbers in 2019. Since Dobbs, have you seen influxes in patients coming, going between states to access care?
Absolutely. We're seeing patients trying to get out of state to get the care that they need, although we also know that many people are not able to do that and are being forced to continue pregnancies that put their health at risk, that are being forced to deliver because they don't have the resources to get out of state.
Okay, thank you. I'm going to ask one question in my remaining time of you, Professor Goodwin. One judge in Amarillo and two on the Fifth Circuit would have entered an injunction setting limits, saying you cannot receive mifepristone by mail, you can't get it over the counter in the pharmacy, that they're going to have it be available not in up to 10 weeks, but 7 weeks instead. And as you know, that's currently on hold. And one of the things the Justice Department argued was that the doctors who brought this case, unlike the American Medical Association, that's made it very clear that this drug is safe and it's been used in 60 countries over 23 years in America. The Department of Justice, those few doctors that brought this case, argued that the Department of Justice said they should not be able to sue because they hadn't been impacted by the approval of mifepristone, and they were not going to be impacted in the future, unlike someone say that we've just heard from in Ms. Zarofsky. So I thought this was interesting because, as you know, Justice Scalia has made similar comments to this, where he rejected a lawsuit saying it would make a mockery of our prior cases, that basically you wouldn't have the standing to bring a case when you haven't had harm or expect to have harm. Quickly, do you want to comment on that and what standing really means and why this case should fall on the standing of those that brought it?
The case itself was absurdist. What the petitioners claimed was that the FDA had rushed to judgment with approving this drug. That drug spent over 54 months of review. 2000, it came into the marketplace. Other drugs that were approved in that same period had spent 15 months of review. What we know is that it's safe. It's a drug that had already been used in Europe, and in 23 years since it was approved in the United States, we know that the safety of mifepristone is that it's far safer than penicillin, Tylenol, even Viagra. The claims that somehow these petitioners, including a dentist, will somehow be overwhelmed with patients who have used mifepristone but who will seek their care is truly absurdist, because in 23 years that has not happened. That has not been the experience of the petitioners at all. And it is worth noting that this was a form of forum shopping, looking for a very specific judge who had already articulated anti-abortion views and placing a petition before that specific judge.
Thank you.
Thank you. Senator Grassley?
Dr. Walbenhorst, could you explain how women can still receive compassionate